The lower back, or lumbar region, plays a critical role in overall strength, posture, and functional movement. A well-developed lower back not only enhances performance in weightlifting and athletics but also reduces the risk of injuries and chronic pain. Growing a massive lower back is not just about aesthetics, it's about power, endurance, and resilience. Various factors influence lower back growth, including genetics, training intensity, exercise selection, recovery, and nutrition. While some individuals naturally have a stronger posterior chain, targeted training can significantly improve lower back size and strength at any age. Anatomy of the lower back. Understanding the muscles involved in the lower back is crucial for developing a structured training approach. Erector spinae. This group of muscles runs along the spine and is responsible for spinal extension, rotation, and lateral flexion. It consists of the iliacostalis, longissimus, and spinalis. Quadratus lumborum, QL. Located deep in the lumbar region, this muscle supports lateral flexion and stabilizes the pelvis and spine. Multifidus. A deep muscle that helps with spinal stabilization and protects against lower back injuries. Glutes and hamstrings. While not technically part of the lower back, these muscles play a vital role in supporting lumbar function and strength. A massive lower back results from the hypertrophy and strength development of these key muscles through progressive overload and strategic training. Muscle fiber composition and growth potential. The muscles of the lower back contain both slow twitch, type 1, and fast twitch, type 2, fibers, but they are predominantly type 1 due to their role in maintaining posture. However, they still respond significantly to heavy resistance training, which stimulates hypertrophy in both fiber types. Type 1 fibers. These are endurance-based and require high-volume training with moderate resistance. Type 2 fibers. These grow larger and stronger when subjected to heavy loads and explosive movements. A well-rounded approach to lower back training must incorporate both high representative endurance work and low representative heavy lifting to maximize muscle growth and strength. The science of hypertrophy in the lower back. Muscle hypertrophy occurs when muscle fibers experience mechanical tension, metabolic stress, and muscle damage, leading to growth. The following mechanisms contribute to hypertrophy. Mechanical tension. Heavy resistance training places tension on muscle fibers, stimulating adaptation. Deadlifts, good mornings, and hyperextensions are effective for increasing tension. Metabolic stress. High representative training creates a buildup of metabolic byproducts, leading to cellular swelling and muscle fiber recruitment. This is crucial for the endurance aspects of the lower back. Muscle damage. Eccentric loading, such as slow negatives in Romanian deadlifts, causes micro tears in the muscle, which repair and grow stronger over time. Combining these factors ensures maximum lower back hypertrophy and strength development. Best exercises for a massive lower back. Developing the lower back requires a mix of compound and isolation exercises. Deadlifts, conventional, sumo, Romanian, the king of all lower back exercises. Deadlifts activate the entire posterior chain and promote massive hypertrophy when performed with progressive overload. Good mornings. A highly effective movement that emphasizes the eccentric stretch of the erector spinae, leading to muscle damage and growth. Hyperextensions, back extensions. These strengthen the lower back with minimal spinal compression and allow for high-volume training. Rack pulls. A partial deadlift variation that focuses on the top half of the lift, placing enormous tension on the erector spinae. Reverse hypers. Developed by Louis Simmons, This exercise is excellent for spinal decompression and strengthening the lower back without excessive strain. Farmers' walks and heavy carries. These engage the lower back isometrically, improving endurance and core stability. Bridges and hip thrusts. Although primarily a glute exercise, they indirectly strengthen the lower back by improving posterior chain activation. Training strategies for different age groups. The ability to grow a massive lower back varies across age groups due to differences in hormone levels, recovery capacity, and injury susceptibility. Teenagers, 15–19 years old. This is a prime time for muscle growth due to high testosterone and growth hormone levels. Strength training should focus on technique, progressive overload, and full body development. Deadlifts and hyperextensions should be a staple. Young adults, 20–35 years old, the best age for hypertrophy. Individuals in this group should emphasize heavy compound lifts with a mix of volume training. Recovery should be optimized with proper nutrition and sleep. Middle-aged adults, 36–50 years old. While muscle growth is still possible, recovery takes longer. Strength training should be complemented with mobility work and controlled volume to prevent overuse injuries. Older adults, 51+ years old, training should focus on maintaining muscle mass, preventing atrophy, and ensuring spinal health. Isometric exercises, lighter loads, and controlled movements are best. Role of nutrition in lower back growth. Protein intake. Essential for muscle repair and growth. Aim for 1.6–2.2 grams per kilogram of body weight. Carbohydrates. Provide energy for training. Complex carbs like oats, rice, and potatoes should be prioritized. Fats. Support hormone production, which is crucial for hypertrophy. Include healthy fats from avocados, nuts, and fatty fish. Hydration. Dehydration can lead to muscle cramps and poor recovery. At least 3–4 liters of water per day is recommended. Recovery and injury prevention. Sleep. Growth hormone secretion peaks during sleep, making it essential for muscle repair. Mobility and flexibility. Incorporating yoga or dynamic stretching can improve spinal health and prevent injuries. Deload weeks. Every 4–6 weeks, a reduction in training intensity helps prevent overtraining and allows recovery. Massage and myofascial release. Foam rolling and deep tissue massage enhance blood flow and reduce muscle tightness. Common mistakes that hinder lower back growth. Neglecting proper warm-up. Cold muscles are more prone to injury. Over-reliance on machines. Free weights stimulate more muscle fibers than machines. Poor form in deadlifts. Rounding the lower back leads to disc injuries. Ignoring core strength. A weak core compromises lower back development. Conclusion. Growing a massive lower back is a combination of strategic training, nutrition, and recovery. By understanding the science of hypertrophy, utilizing the best exercises, and adapting training for different age groups, anyone can develop a powerful and well-defined lower back. Consistency, proper form, and intelligent programming are key to unlocking maximum gains.